with talking about our chief guest and teacher, Shailaja, who is a member of the Legislative Assembly of Kerala from the Mattanur constituency, but also very importantly, the Central Committee member at the CPIM. She is the former Minister for Health, Social Justice, Women and Child Development of Kerala. And popularly known as Shailaja Teacher, she is the author of several books on gender, communism and public health in Malayalam. She is also Joint Secretary of the All India Democratic Women's Association. I am also delighted that I've been able to spend so much time, and we are honored at Prakriti Foundation that she has agreed to come here today. To my right is Dr. Nalini Krishnan, who is an MD in internal medicine and has specialized in tropical diseases and industrial medicine. She has more than 30 years experience in designing health programs in community health and workplace. Dr. Krishnan is one of the founding members of REACH, the Resource Group for Education and Advocacy for Community Health, an organization working to build a multi-stakeholder approach in public health with a focus on ending TB, tuberculosis, by engaging with communities. I'm also delighted that she's a friend and she's agreed from her schedule to come here. The translator, unfortunately, who is not here, is Mr. T.A. Srinivasan, and I must talk about him. He was born in the village of Tirupati Saram in Kanyakumari district, Tamil Nadu. His mother tongue is Tulu, and yet he has translated into Tamil from English a Turkish novel by Ahmed Hamdi Tanbinar, a novella and a travelogue by Shirshendu Mukhopadhyay, a book of critical essays by Romila Thapar, and the autobiography of Dharmand Kosambi. He served in a public sector undertaking and has been doing copy editing for Kala Chaudu publications for 2.5 decades. This is his 6th book of translation. Prabha Sridevan, retired justice, who also we can have the honor of calling a friend, has been a judge of the Madras High Court from 2000 to 2010. She was then the chairman of the Intellectual Property Appellate Board from 2011 to 2013. Her important judgments include freedom of speech, economic values of a homemaker's work, the right to education, the Novartis case, and the Bayer compulsory license. She has also chaired the think tank to draft India's IPR policy. She has translated works from Tamil to English and has published 8 books, including Chudamani's short stories, Echoes of the Veena, which won the Translation Award at the Valley of Words Festival 2019. We are also privileged to have with us Sir K. Balakrishnan, an Indian politician and former member of the Tamil Nadu Legislative Assembly from the Chidambaram constituency, and he is a former secretary of the CPIM Tamil Nadu. This afternoon and the generous use of this space would not have been possible without my thanks to Sir Paneer Selvam, who is also a friend and has been a great supporter of all the work that we do at Prakriti Foundation. So without further ado, if we have copies of the book, we would first like teacher to hand over to Sir and to Prabha ma'am.
This is wonderful indeed.
இது தமிழ் புத்தகங்கிறதால நான் தமிழில் தான் பேச போகிறேன். இது ரொம்ப முக்கியமான நூல். நான் இந்த ஆங்கிலத்தில் படித்த போதே நினச்சேன், திரும்ப திரும்ப நம்ம கிளாஸ் சீலிங்னு ஒன்று சொல்கிறோம்ல, கிளாஸ் சீலிங்னு ஒன்று இருக்கோ என்னவோ, எனக்கு அந்த வார்த்தையும் அவ்வளோவா பிடிக்காது. பட் இவங்க எப்படி எல்லா தடைகளையும் உடைக்கிறது மட்டும் இல்லை, எவ்வளவு மக்களுக்கு உபயோகமாக தன் லைஃப்பை செதுக்கிக்க முடியுங்கிறது அந்த இந்த புஸ்தகத்தில் அது ரொம்ப இன்ஸ்பைரிங்காக இருக்குது. நீங்கள் எல்லோரும் நீங்கள் மினிஸ்டர் ஆகணும்னு தேவையில்லை, பாலிட்டிக்ஸுக்கு வரணும் தேவையில்லை, எங்கே நீங்கள் இருக்கீங்களோ நீங்கள் ஷைலஜா டீச்சர் மாதிரி இருக்கணும். That is my prayer. Thank you. Thank you, Prakriti, for honoring me with this.
Thank you for being such a great support.
நண்பர்களே, கேரளத்தில் இருக்கிற அந்த மாநில கம்யூனிஸ்ட் கட்சி தலைவர்கள் ஒரு முக்கியமான தலைவராகவும் கேரள அரசாங்கத்தினுடைய மக்கள் நல்வாழ்வுத்துறை மற்றும் பெண்கள் வளர்ச்சித்துறை ஆகிய துறையினுடைய அமைச்சராக இருந்து ஒரு நெருக்கடியாக மிகுந்த காலத்திலே பணியாற்றிய ஷைலஜா டீச்சர் அவர்களுடைய நூலை இன்றைக்கு தமிழிலே மொழிபெயர்த்து இங்கே வெளியிடுகிற நிகழ்ச்சி இங்கே நடைபெற்று கொண்டிருக்கிறது. இந்த நிகழ்ச்சியிலே நம்முடைய உயர்நீதிமன்ற முன்னாள் நீதிபதி பிரபா ஜிதேவன் அவர்கள் இங்கே கலந்து கொண்டு இந்த நூலை பெற்றிருக்கிறார்கள். அவர்களுக்கு ஒன்றும் பெரிய அறிமுகமெல்லாம் தேவையில்லை. ஏற்கனவே சென்னை உயர்நீதிமன்றத்தால் பல்வேறு முக்கியமான தீர்ப்புகளை வழங்கி பெருமைப்படுத்தியவர் அவர். குறிப்பாக தமிழ்நாட்டில் சமச்சீர் கல்வி வேண்டுமா வேண்டாமா என்கிற ஒரு பெரிய விவாதம் நடந்தபோது தமிழ்நாடு அரசாங்கம் டாக்டர் கலைஞர் அவர்கள் முதலமைச்சராக இருக்கிற போது சமச்சீர் கல்வி சட்டம் என்கிற சட்டத்தை நிறைவேற்றிய போது அந்த சட்டத்தை எதிர்த்து பல பேர் உயர்நீதிமன்றத்திலே மனுக்கள் போட்ட இந்த நேரத்தில் அந்த மனுவை ஒரு டிவிஷன் பெஞ்ச் என்கிற அடிப்படையில் நம்முடைய நீதிபதி பிரபா ஜிவேந்தர் அவர்கள் அந்த வழக்கை விசாரித்து ஒரு மிக நீண்ட தீர்ப்பை அதில் எழுதியிருப்பதை நம்மால் பார்க்க முடிந்தது. அவருடைய தீர்ப்பின் மூலமாகத்தான் தமிழ்நாட்டில் எல்லாருக்கும் ஒரு சமசீரான கல்வி, சமமான கல்வி அந்த கல்வியை உறுதிப்படுத்தியது அந்த தீர்ப்பு தான். இல்லை என்றால் பிறப்பால் அல்லது பொருளாதாரத்தால் ஏற்றத்தாழ்வு மிக்கவர்களுக்கு ஏற்றத்தாழ்வான கல்வி என்கிற அப்படிப்பட்ட நிலைமை உறுதியாக இருக்கும். அப்படி பல்வேறு வழக்குகளிலே இன்னும் சொல்ல போனால் ஊழியர்கள் நலன் சார்ந்திருக்கிற பல்வேறு வழக்குகளில் அப்படிப்பட்ட தீர்ப்பை எல்லாம் அவர் வெளியிட்டிருக்கிறார். அவர் நீதிபதியாக இருந்து பணியாற்றியதை விட இப்போது பல நல்ல நூல்களை அவர் தமிழிலே மொழிபெயர்த்திருப்பது ரொம்ப பெருமைக்குரிய ஒன்று. இங்கே நம்முடைய சாகித்ய அகாடமி விருது பெற்றிருக்கிற ஆசிரியர் இமயம் அவர்கள் இப்போது இன்னும் வந்து கொண்டிருப்பார்னு கருதுகிறேன். அவர் உண்மையிலேயே ஒரு அடித்தட்டு மக்களுக்கான நிறைய நாவல்களை படைத்திருக்கிறார். அந்த நாவல்கள் எல்லாமே ஒரு சமூக நீதியை வலியுறுத்துகிற, சமூகத்தில் இருக்கிற ஏற்றத்தாழ்வுகளுக்கு முடிவு கட்டுகிற அப்படிப்பட்ட நாவல்களாகத்தான் அவர் படைத்திருப்பார். அந்த நாவல்களை பெரும்பகுதியான நாவல்களை நம்முடைய நீதிபதி அவர்கள் தமிழிலே அவருடைய நாவலை மட்டும் 4க்கு மேற்பட்ட 4 5 அவர் 4 மொழிபெயர்த்திருக்கிறார். அந்த நாவல்களை தமிழிலிருந்து ஆங்கிலத்திலே மொழிபெயர்த்திருக்கிறார். அவர் தமிழில் எழுதியிருக்கிறார், இது ஆங்கிலத்திலே மொழிபெயர்த்து இந்தியா முழுமைக்கும் அதை படிக்கிற ஒரு நல்ல வாய்ப்பினை பெற்றிருக்கிறார். அந்த இமயம் அவர்கள் விரைவில் இங்கே வருவார்னு எனக்கெல்லாம் ரொம்ப அவருடைய நாவல் ரொம்ப பிடிக்கிறது. காரணம் என்னென்னா, அவர் ஒன்று சிறந்த நாவலாசிரியர் என்பது ஒன்று, 2வது எங்கள் சொந்த மாவட்டத்தை சேர்ந்தவர்களும் அது ஒரு முக்கியமான காரணம். எனவே அப்படிப்பட்ட ஒரு நல்ல நீதிபதி, ஒரு நல்ல சமூக சிந்தனையாளர், நல்ல மொழிபெயர்ப்பாளர் என்கிற பல்வேறு தளங்களிலே பணியாற்றி கொண்டிருக்கிற அவர் இந்த நூலை பெறுகிற ஒரு வாய்ப்பு பெற்றிருக்கிறது. ஷைலஜா டீச்சர் எழுதியிருக்கிற அந்த வரலாறு என்பது ஒரு சாதாரண கிராமத்தில் இருக்கிற ஆசிரியராக இருந்து ஒரு அரசாங்கத்தினுடைய உயர்ந்த பொறுப்புக்கு வந்து பணியாற்றக்கூடிய அவைகளை அவர் மிக நல்ல முறையிலே எழுதியிருப்பார். நான் ஆங்கிலத்தை படித்ததிலே தமிழிலே தான் காலையிலே நேற்று இரவு தான் பார்த்தேன். அந்த ஸ்ரீனிவாசன் அவர்கள் இங்கே இல்லை. ஆனால் அது பார்க்கிற போது அது ஆங்கிலத்திலிருந்து மொழிபெயர்த்த நூல் என்று யாரும் சொல்ல முடியாது. அந்த அளவுக்கு தமிழிலே அவ்வளோ எளிமையாக ரொம்ப உள்வாங்கி அந்த நாவல் அந்த வரலாற்று நூலை தமிழிலே மொழிபெயர்த்திருப்பது என்பது ஒரு சிறந்த மொழிபெயர்ப்பாளர் என்பதற்கு எடுத்துக்காட்டாக அந்த மொழிபெயர்ப்பு அமைந்திருக்கிறது என்பதை நாம் பார்க்கிறோம். இன்னும் சொல்ல போனால் அமைச்சர்கள் நிறைய பேர் இருக்கிறார்கள், நாட்டில் ஏராளமான பேர் அமைச்சர்களாக இருக்கிறார்கள். ஆனால் குறிப்பாக 2016 21 ஆண்டு வரை ஒரு 5 ஆண்டு காலம் கேரளத்திலே சுகாதாரத்துறை அமைச்சராக பொறுப்பேற்ற காலம் ஒரு சவால்கள் நிறைந்த காலம். அது கேரளாவிலே நிபா என்கிற அந்த பெருந்தொற்று ஏராளமான மக்களை கொன்று குவித்த வரலாறு நாம் பார்த்திருக்கிறோம். அந்த தொற்றிலிருந்து அந்த கேரள மக்கள் மீண்டெழுவதற்குள் அடுத்து ஒரு பெரிய இயற்கை பேரிடர் வந்தது. அதனைத் தொடர்ந்து கோவிட் பெருந்தொற்று என்பது உலகத்தையே உலுக்கிய வரலாற்றை நாம் பார்க்கிறோம். எனவே அப்படி நிஃபா பெருந்தொற்றிலிருந்து மக்களை காப்பாற்றியதோடு உலகையே உலுக்கிய அந்த கோவிட் பெருந்தொற்றிலிருந்து அந்த மக்களை எப்படி காப்பாற்ற அவர் போராடினார் என்பதை அதை படிக்கிற போது தான் நமக்கு அந்த ஒரு போர்ஷன் மட்டும்தான் நான் படித்தேன். ஒரு இரவு பகலாக எப்படி அந்த மருத்துவத்துறை 24 மணி நேரமும் ஒரு ராட்சச வேகத்தில் செயல்பட்டது என்பதை அந்த நாவலிலே அந்த வரலாற்று நூலிலே நம்மாலே பார்க்க முடிகிறது. ஆகவே தான் உலகத்தில் பல நாடுகளில் கோவிட் தொற்றில் பெருந்தொற்றில் அதிகமான பேர் உயிரிழந்தாலும் கூட, இந்தியாவில் பல மாநிலங்களில் உயிரிழந்தாலும் கூட மிக குறைவான மக்கள் உயிரிழப்பு ஏற்பட்ட மாநிலம் என்று சொன்னால் அது கேரளம் தான் என்று பெருமையோடு நாம் சொல்ல. அப்படிப்பட்ட ஒரு மகத்தான பணியை ஷைலஜா டீச்சர் அவர்கள் சுகாதாரத்துறை அமைச்சர் என்ற முறையில் பணியாற்றியது. அந்த துறை முழுவதும், அந்த நிர்வாக குழு முழுவதும் அதை இயக்க பணியை அந்த பணியில் ஈடுபடுத்தியது அவர் உலக அளவில் பாராட்டக்கூடிய ஒரு பெரும் புகழை பெற்றது. ஆகவே தான் அவருக்கு ஐக்கிய நாட்டு சபையினுடைய ஐக்கிய நாட்டு சபையை அவரை அழைத்து ஒரு அதிகமான மக்களை பெருந்துயரத்திலிருந்து காப்பாற்றிய அந்த பெரிய சேவைக்கான விருதை அவர் வழங்கியிருக்கிறது என்று சொன்னால் அந்த பணி எவ்வளவு சிறந்த பணி என்பதை நம்மால் புரிந்து கொள்ள முடியும். எல்லாவற்றையும் எழுதிவிட்டு அவர் கடைசியாக எழுதுகிறார். அதை படிக்கிற போது தான் நமக்கே தெரியும். அதாவது ஒரு சாதாரணத்திலிருந்து நான் உயர்ந்த மட்டத்துக்கு போனாலும் எப்போதுமே என்னை ஒரு அதிகார மையமாக நான் கருதியதே இல்லை என்று அவர் ரொம்ப பணிவோடு சொல்கிறார். அதில் பணியாற்றக்கூடிய அமைச்சர் தலைமை பொறுப்பில் இருந்தாலும் கூட அதில் பணியாற்றக்கூடிய ஒரு ஊழியனாகத்தான் நான் பணியாற்றினேன் என்பதை அவர் பெருமையோடு சொல்லுகிற அந்த காட்சியை நம்மாலே பார்க்க முடிகிறது. உண்மையிலேயே அந்த நூல் பல சமூக நியாயங்களை எடுத்து சொல்லுகிற நூலாக, ஒருவர் எப்படி தன்னுடைய வாழ்க்கையை அமைத்து கொள்ள வேண்டும் என்கிற அவர் ஒரு கம்யூனிஸ்ட் கட்சியில் தன்னை இணைத்து கொண்டதிலிருந்து, கம்யூனிஸ்ட் கட்சியினுடைய மத்திய குழு உறுப்பினராக பணியாற்றியதிலிருந்து, சட்டமன்ற உறுப்பினராக பணியாற்றி பிறகு அமைச்சராக பணியாற்றினாலும் கூட எல்லா தளங்களிலேயும் 24 மணி நேரமும் சுறுசுறுப்போடு எப்படி பணியாற்றுவதற்கு நான் பணியாற்றேன் என்பதை அவர் படிக்கிற போது நாமெல்லாம் கூட அப்படி பணியாற்ற வேண்டும் என்று நமக்கு ஒரு உந்துதலை உருவாக்குகிற அப்படிப்பட்ட நிலைமையை நமக்கு உருவாக்குகிறது. என்னதான் இருந்தாலும் ஒரு பெண் என்கிற போது பார்க்கிற போது அவர்களுடைய குடும்ப சுமைகளும் அவருடைய பிள்ளைகள் வளர்ப்பை பற்றியெல்லாம் அவர் எழுதுகிற காட்சி ரொம்ப சங்கடமாக தான் இருக்கும். ஏன்னா குழந்தை வளர்ப்பிலே இன்றைக்கி சமூகத்தில் பெண்கள் ஏதோ ஒரு விதத்தில் கட்டாயத்தில் பிணைக்கப்பட்டிருக்கிற ஒரு சூழல் தான் இருக்கிறார். எனவே அந்த கடமையை தட்டி கழிக்க முடியாமல் பல நேரங்களில் ஏற்பட்டிருக்கிற சிரமங்களை எல்லாம் கூட விளக்கியிருப்பதை நம்மாலே பார்க்க முடிகிறது. அது மட்டுமல்ல, கேரள சமூகம் எப்படி பல விஷயங்களே ஒரு முன்னேறிய சமூகமாக இருக்கிறது என்பதையும் அதில் புரிந்து கொள்ள முடிகிறது. அதாவது ஒரு விதவை ஒரு கணவனை இழந்துவிட்டால் காலம் முழுவதும் ஒரு விதவையாகவே இருக்க வேண்டும் என்கிற கொடுமை இந்தியாவிலே எல்லா மாநிலங்களிலும் இருக்கிற போது காலத்துக்கும் பல ஆண்டுகளுக்கு முன்னாலேயே அங்கே மறுமணம் செய்து கொள்ளுகிற அப்படிப்பட்ட ஒரு பழக்கம் இந்த சமூகத்தில் எப்படி முன்னேறிய ஒரு சமூகமாக அதற்கு இருக்கிறது என்கிற அந்த சமூகத்தை பற்றியும், அந்த சமூகத்தில் இருக்கிற பல்வேறு பழக்க வழக்கங்கள், அதே போல் அங்கே இருக்கிற இயற்கை காட்சிகள் எல்லாவற்றையும் கூட அவர் அந்த நூலிலே மிக அழகாக எழுதியிருப்பதை நம்மாலே பார்க்க முடிகிறது. எல்லாவற்றை விட கடைசி அத்தியாயமாக இருக்கிற ஒரு அத்தியாயம் கேரள மாடல் என்று சொல்லுகிற ஒரு அத்தியாயம் ரொம்ப ரொம்ப முக்கியமானது. எப்படி இந்தியாவிலே பல மாநிலங்கள் இருந்தாலும் பல்வேறு மாடல்கள் இருந்தாலும் அது கேரளாவிலே இருக்கிற இடதுசாரி மாடல், சோசியலிச மாடல் தான் ஒரு மாற்றான மாடலாக மக்களுக்கு எப்படி பணியாற்றி கொண்டிருக்கிறது. சமூகத்தில் எத்தனை ஏற்றத்தாழ்வு இருந்தாலும் இந்த மாடல் தான் சமூகத்தில் இருக்கிற எல்லாருக்கும் சமமான ஒரு முன்னேற்றத்தை அளிக்க வேண்டும் என்கிற ஒரு மாடலாக நாங்கள் செயல்படுத்தி கொண்டிருக்கிறோம் என்பதையும் அவர் அந்த நூலிலே தன்னுடைய லட்சிய பயணத்தை முடிக்கிற போது அவர் எழுதியிருப்பதை நம்மாலே பார்க்க முடிகிறது. எனவே அது அவருடைய சொந்த வாழ்க்கையாக இருந்தாலும் கூட, அவருடைய வாழ்க்கை அனுபவங்களாக இருந்தாலும் கூட அதிலிருந்து நாம் நிறைய கற்றுக்கொள்வதற்கும் நிறைய புரிந்து கொள்வதற்கும் அதை முன்னெடுத்து நம்முடைய வாழ்க்கையிலும் நாம் பல முன்னெடுப்புகளை மேற்கொள்வதற்கும் கூட அந்த நூல் ஒரு உந்து சக்தியாக இருக்கும் என்பதை இந்த நேரத்தில் தெரிவித்து இந்த நூலை வெளியிடுவதற்கு வாய்ப்பளித்திருக்கிற நம்முடைய பத்திரிகையாளர் பன்னீர்செல்வம் உட்பட பலரும் இங்கே வந்து வருகின்றிருக்கிறார்கள். எங்கள் கட்சியுடைய மாவட்ட செயலாளர் உட்பட வந்திருக்கிறார்கள். எனவே எல்லாருக்கும் இந்த நேரத்தில் நன்றி தெரிவித்தோடு காலச்சுவடு பதிப்பகம் இதை நல்ல முறையில் வெளியிட்டிருக்கிறார்கள். நல்ல மொழிபெயர்ப்பு, நல்ல தெளிவான அச்சு. காலச்சுவடு எப்போதுமே அப்படி நல்ல தேர்ந்தெடுத்த நூல்களை வெளியிடுவார்கள். அப்படி நிறைய நூல்கள், அவருடைய நூல்களை நாம் படித்திருக்கிறோம். எனவே அந்த நூல் எல்லாருடைய கையிலேயும் இருக்க வேண்டிய ஒரு நூல், எல்லாரும் கட்டாயமாக படிக்க வேண்டிய ஒரு நூல் என்பதை இந்த நேரத்தில் சொல்லி அனைவருக்கும் மீண்டும் என்னுடைய பணிவான நன்றியை தெரிவித்து நிறைவு செய்கிறேன். நன்றி.
Asking both of you to please tell us what was the starting point. You were in the government and then came to the area of health as your work took you there as a minister, and you were a trained doctor who got into community health. So if you can both talk a little bit about the starting point, the genesis of your work, of your coming into the space of public health. I'll let you go first, teacher.
Yes, thank you, sir. I'm so proud to be here with such a intelligent company. K. Balakrishnan released my Tamil book, translated by Srinivasan. Srinivasan is not here now. And Madam Prabhasri Devan, whom I respect more than anything. I was familiar with her last time when the discussion of my book was there. Tamil Nadu at that time, Madam participated in that function, and she gave me 2 books at that time. One is her experiences and the other is Imayam's stories. Yes, Comrade Balakrishnan sir. You sir? Okay. And I read it. That is the experiences of the downtrodden people. And the way Imam sir put it, also very touching, and Prabha Madam also, as we said, that her judgment about for the down-to-earth people, how to save them. So I am so much proud of it. And also these students, all the important personalities are here. I am not explaining or mentioning everyone. And the students, they are studying journalism and how to explore the difficulties of the poor people and how to solve it. In your future, you should be discussing about that. As journalists, you have it is the 4th state of the Indian democracy, we can say so. So you should be ready to do your duty on democracy. So I am so much interested to hear from these journalists or students of journalism. This is the first time I am working with the Communist Party, and the motive of Communist Party, as you all know, is to build an egalitarian society. Socialism. Socialism means egalitarian society. How to build it? Everyone have to work for the society, and everyone got remuneration for that, and the life was very happy in such a society. So we are trying to implement the socialistic things in the society. Previously, my family was a communist family, 1930s and 40s. My granduncles were freedom fighters, not leaders, but the local leaders, great leaders. But they were fighting to get freedom, fighting against British rule. At the same time, they came to know about the socialist ideology, about Karl Marx, Engels, and they were interested in that kind of politics, And they joined in Congress Socialist Party first, and after that Communist Party, and they organized the agricultural workers and poor Kisans in our place. At that time, the landlordism was there and it is rampant in Kerala, The August Bebel said, who is a historian in the time of Karl Marx, he said, the landlordism in Malabar is our place in Kerala. The landlordism Malabar is more severe than the slavery in Greece, Their rituals and that kind of thing they implemented or compelled the poor people to do hazardous thing. We cannot even imagine the untouchability and what is the fate of the poor people in the lower caste. We cannot imagine that thing. At that time they organized the poor people and fought against the landlordism to get food, simply to get rid of starving. People were starving day after day, nothing to eat at that time. And some of the struggles become victory, and they won some struggles and got some food from that. And 1957, the left government came in power just after formation of the linguistic states in India. Kerala formed. 3 princely states joined together to become the part of democratic India, and that is Travancore and Cochin and Malabar. And we became the United Kerala. In that Kerala, the government, the first election through ballot paper, the left came in power, and E.M. Shankaran Namboodiripad became the chief minister. The very first day, just after taking oath as chief minister, he put forward an ordinance, that is stay of eviction ordinance. No one can be evicted from the land. That was the first ordinance and first legislation in Kerala, we can say so. After that, the poor people feel some enthusiasm that this soil is ours, land is ours, and no one will evict from this land. And I was born in 1957, the time when the left government formed in Kerala, the same year, 1957. And seeing all these things, I was also participating with my grandma in all the land struggles, etc. You know, grandma is also not a great leader, but a brave lady. I explained about her in my book, how she fought against the infectious disease like smallpox, and the people love her very much because everywhere and anywhere the people want her to help, any help. She will be there. That is her nature. And my role model is my grandma now. Also I am thinking about her every day, you know. And slowly I came to politics and I become the worker of Youth Front and also the Women Front, and I come up CPM's district committee and state committee, and after now central committee. I become MLA while I was area committee member of CPIM, and I become minister while I was central committee member of CPIM. And when I became minister in 2016, I have no other experience, so only the social work, political work. But I have the problem of the people in my mind. What we should have to do for the poor people. And Kerala was so much developed at that time, 2016. And our public health system is very rampant because even in the first government, 1957 government, Dr. A.R. Menon was the health minister. Very prominent, eminent personality, Dr. A.R. Menon. And he decided to have primary health centers in each and every panchayats at that time. If any panchayat can give 1 acre of land, we can start one primary health center there. Years after, our central government also decided to have primary health centers in villages and also the sub-centers for 5,000 population, one sub-center in each and every village. And at that time, 1957, that government cannot fulfill these things. Continuously, after years, we fulfilled that thing. Each and every panchayat has one primary health center. But when I become minister, I have to improve it. Our government, our chief minister and our cabinet decided to improve health system according to the contemporary era, technologically fit and also people's friendly. So we have started a mission called Ardra, and I discussed everything with my health secretary and also the doctors and all the health staffs, and we created some idea. I explained in my book how we formed this, changed these primary health centers to family health centers. I have some concept about the family health system in Cuba, but I didn't visit Cuba, never. But in my mind, that system is there. But I visited United Kingdom, UK, and the NHS scheme is there. I directly visited to an NHS, and I found what is there. There are some good idea in an NHS system, and I copied that thing into our family health center, and we started implementing and started rejuvenating or reforming the health system. I have ideas I got from people, and bureaucracy is there, and we arranged or united all the bureaucracy to implement this work, and we formed very good team. That teamwork helped a lot. Not only the reformation of the infrastructure, but also in clinical practice also we have so many new things there. I am not explaining everything now. If students ask any questions at that
And
time.
also they should buy the book.
They should buy
Yeah.
The whole story.
I explained everything. What reforms we made in the that 5 years, fruitful years, I can say so. I got so many experiences. I understand as the veterans or the thinkers said, each crisis is an opportunity for a human being. And I got opportunity in Nepal and COVID period also. And I also expanded my thinking and my ability and everything. And if you work hard, you can accept we can get rid of the challenge or fight with enthusiasm. That is my experience.
Thank you. And I'll ask you now, you were trained as a doctor.
Yeah.
How did you get into community health?
Yeah, that was totally by happenstance. Never intended to be a public health person. All I trained in internal medicine, and somehow the idea of private practice, sitting in a clinic, never appealed to me. And then two things happened at that point in time when we decided to start REACH. One was the revised National TB Control Program. There was a TB control program that was reviewed in 1998 and found that only 30% of people on treatment were getting cured. And there was a huge number of TB deaths also happening at that time. So they revised this program to make it more effective but also more complicated. It was called the DOT strategy. People of my generation would have heard about it. The youngsters here, maybe a thing of the past. So under the DOT strategy, they started a short-term treatment. Usually the treatment is so long that it would have been for 18 months or 2 years. They made it a 6 months treatment. But the challenge here was the patients had to take the treatment under the observation of a healthcare provider. So that is one situation. The second important thing we came to know was more than 70 to 80% of people, irrespective of whether they were from the urban or the rural areas, would go first to a private provider for treatment and not to a government hospital. Private provider doesn't mean a fancy hospital. You just go to the pharmacy next door, or they will just go to not to the PHC, but a small time, high school street practitioner, because that was the easiest for them. The timings were more convenient for them. Whereas in a public health service in Tamil Nadu, it's a 9 to 5. So somebody has to go to the hospital to go to work. That whole day's wages are more. So the two things we had to tackle was, so I got into it because I had worked at the ICMR TB Research Center after I finished my ME, and I was just invited for a discussion. And we got Professor M.S. Swaminathan, I think needs know it, and all of you know. So we thought we need someone. What was similar was, here was an agricultural scientist who had taken the results of science into practice and right into the field. So he was able to do agricultural reform because he had farmers, consulted farmers being on track right from the beginning. They were planning the programs with the farmers. It was not like a top-down approach where they discovered something and then they would just, expect someone to blindly do it. So we thought here is a master of bringing science into action, or science into reality, or bringing science to reach the bed to benefit the common person. So we invited Professor actually just by chance, and he really liked the idea. He just looked at me and said, "You better start an NGO." I didn't know what it was to even start an NGO, but anyway, we sort of started this with the support of Professor Swaminathan, and Dr. Soumya Swaminathan continues to advise and work with us very closely even today. And of course, the National Institute of Research in TB, which used to be known as the TB Research Center. And the third component is we worked very closely with the government. We did not try to set up a parallel infrastructure because that will not be sustainable. So every patient that was diagnosed was reported into the government system. Well, what the diagnosis were they cured, did they go into drug-resistant TB? So we started this as a three-way kind of engagement with REACH and TB with the research component as well as with the government. And then how did we actually implement this is that we decided to place social workers whom we call TB Nandans we got about 40 hospitals, private hospitals, to host us. They just give us a room. Our TB Nandans are sitting there. So patients who come to the hospital with symptoms of TB or diagnosed with TB are handed over to our care. Because what does it involve? Just writing a prescription saying take this for 6 months. A busy private practitioner has no time to actually see if that patient is really taking the meds. So our social workers, they're not even social workers, they are girls and boys from the community, 10th standard, 12th standard, Pachavanga. We give them some training and they just join the TB Nandan, and they are the rock for us. The kind of passion they bring to their work and avlo commitment, they will go and actually meet the patients, talk to them and keep them going to the 6 months of treatment. So they are really the core of the work we do, is not all of us sitting in the offices. So we found that our cure rate really went up. So I'm proud to say, at the risk of being immodest, that we have about a 90% cure rate of every patient that we take up, which is more than the state average or even sometimes the national average. So very proud of it, but it's very, very intense work. It requires a lot of funding, it requires a lot of intense. It's something that the government can do, but does not really take it up immediately. So the concept of that is how we started REACH. And the second thing we did was community engagement. So what we have done is cured TB patients. Once they got over the TB, we call them TB survivors. They're not called patients, but we got them into forming networks. So all over now, this program has actually been taken up by the Central TB Division and National Program. So every district is supposed to have a TB survivor network. These people are now very good at counseling other TB patients, keeping them on track and reporting back. So they form like an intermediary between the community and anything wrong with the community, they're able to face it. So these are the steps that we've taken to take things out to the community.
So now we come to the big C word, which was COVID.
Yeah.
And before I go to teacher and she explains us what they did, I want to ask you, for people who are in the community with TB, COVID would have been a time of extreme despair and difficulty. How did you all deal with it? And then I'll ask teacher about, which is there in the book and which is well known in the public realm, but since she's here, it would be great for her to share with us. How did you all deal with TB during the COVID time? And then if you tell us about your...
Yes, yes.
Teacher's experience would be much more. But at our small cohort of patients, those who are diagnosed, we managed to keep them on treatment. Somehow we will get the tablets to them, and we would be calling them and talking to them, and in a limited capacity we could keep counseling them. But what happened was there was a massive drop in patients coming forward. Normally the starting point is somebody comes with a cough or some other TB related symptoms. So the self-reporting vanished. So we had a huge drop in cases, not just with REACH, but in Tamil Nadu there's a huge drop. Less than about 50% of case finding there went down so much. And of course, over the last few years, it's come up. But I think more at an administrative level, we should be able to tell us more.
Over to you, teacher.
Yes, ma'am. In Kerala also, before COVID, we had a very good program on TB eradication. We set some goals just after the goals declared by UN. There are 17 goals declared by
SDG.
UN on SDG sustainable development. And third component is on health. And we also declared some goals in Kerala. One is TB eradication, the other is leprosy eradication. 23 goals we declared at that time.
and also the decreasing or the child mortality rate, how we can decreasing, and maternal mortality rate. This kind of 23 codes we declared, and a special team for TB eradication. It is just under the health department itself. And we have very good district hospitals and very good taluk level hospitals, and also these primary health centers, sub-centers. The public health system is very strong in Kerala. Through this public health system, we try to have these community programs also. We form some special teams in each and every wards in a panchayat, and they were going to the houses directly, checking whether anyone have TB and giving medicine. The most important thing is to take medicine at the right time, right part of life. And that's coursework where, as you said, the at first TB patients just to show an increase in the data, because all of them have been reported, they get reported. And after that we worked hard, and now the number of TB patients diminished a lot. If we work hard with intention, with the community support, social support, I am very much enthusiastic that we can get rid of this problem. Otherwise we cannot. It should be a community program. Participation is the most important thing. People's participation and awareness creation, everything. It was a very good program, TB eradication and leprosy eradication also. And this kind of child mortality rate. So when I took office in 2016 as health minister, the child mortality rate in Kerala is 12 out of 1,000 live births. That was the lowest rate in India. Indian states, lowest. But we take a note, or we decided to make it single digit from 12. And we formed a team and worked hard. So there are so many things that at first we studied what is the reason for the child mortality. And we find out that 30% of the child mortality is due to congenital heart defects. So we started a special mission on it, special program on it, Hridyam. We call it Hridyam. And all the 66 delivery points, we make them to test early detection. There were trained staffs there to find out whether the child have some defects in heart. At once they should report it to Hridyam office in Trivandrum. There are so many units of Hridyam in district level and taluk level also. And if we came to know that a child is born with the congenital heart disease, at once our ambulance will go there and took the child to hospital and get operated, and then more than 50,000 operation was done at that time. So not only that, there are so many other things, milk isolation, that kind of things are also there for infant mortality. But when we examined, NFHS survey in 2020 shows that child mortality in Kerala become 5 out of 5 survivors, from 12 to 5. Now also it is 5. After COVID also it is not increased, it is 5. And one thing is that it is below the child mortality rate in America. USA. That is 5.6. We cannot compare Kerala to America because that is a well-built nation, rich country. But that child mortality rate is 5.6, but Kerala's is 5. Proud to say, That shows that, as ma'am said, if we work with an intention, with the help of community, we can get the result. We are able to get the result. That is the thing in Kerala.
Tell us about
Sorry, I just wanted to say, when we started the TB program, I thought, oh, we're all doctors. The doctor has the smallest role. We really have no role in such public health issues. It's the community, it's the whole system. We talked about your 66 points for the Hridyam. at every point we realize how humble we become, because as clinicians we think we know it all, and the most and the least useful part of the system is the doctor.
Coming to working in public health, undoubtedly both of you had to work with bureaucrats.
Yes.
And tell us about your challenges, cooperation, and I know there is a chapter and a well-known fact about how you dealt with some bureaucrats that you inherited and then won over, so we would love to hear that story. But I'd love to hear from you first, Nalini, and then over to teacher.
See, what I'd like to be very candid here. See, everything has to happen through the system. We're not trying to create a parallel system. I don't really philosophically don't believe in that. But everything hangs on the bureaucrat who is running the program at that time, whether it's the health secretary or even at the ministerial level. Everything depends on who is occupying that seat.
So their intentionality of wanting to make things work.
And the other thing is, they have no respect for NGOs. Respect in the sense, I'm not saying they insult NGOs. I think they do not feel that non-governmental organizations have a place in the scheme of things. As much as the community welcomes an NGO, you will find that in government. Because I think the government feels that it shows them up. I think it's my job to eradicate TB or my job to reduce maternal mortality rate. So why do I need these partners? So that was a very big challenge. It varied so much from official to official. So it always been welcome. But there's a seat, you don't have a seat at the table. Literally, sometimes it'll be sitting outside the door. They'll say, please sit down, and they'll have their meeting, and then we'll call you in toward the end and say, okay, what is it that you want to see? So it's a lot of lobbying, a lot of relationship building, and there are no bad people in this. There are no good people, no heroes in this also. It's a question of trust, and I think after 25 years of reach, today I'm proud to say any of our social workers can walk into any primary health center and be respected and welcome, because you literally have to leave your ego at the door if you want to work with the government.
Yes, I think
your experience with the bureaucrats.
Yes. I think NGOs can support a lot. The government's policy, when we are implementing it, we need help from all parts of society. So many NGOs helped us also during that COVID period. Even Doctors Association, that is not an NGO, IMA and KGMOA, their associations was there. There may be conflicts between us every time, because we believe that the bureaucracy is trying to make the system without any change. Maybe I am wrong, but sometimes we have to fight with them. But I always remembered what Comrade Lenin said just after Russian Revolution. Some comrades asked Lenin whether we can put this bureaucracy in place or dismiss them at once. Then Lenin said, no, we cannot dismiss them because they are sitting with full of experience. And we should think how to make their experience to implement our policy. And that is the real thing, Same way, we also make the bureaucrats to implement our policy. Our policy means we have to discuss together. The IAS officers, they are full of, they have long-term experience, but minister is new to them. She didn't know anything about this, the communicable, non-communicable diseases, their system, etc. According to me, I have to study all these things. But my health secretary at that time, one Mr. Rajiv Sadanandan was the health secretary. He was an eminent personality, but people threatened me, my comrades and colleagues threatened me that he will not listen. He is that kind of a person. And when we came to meet the first time, I frankly spoke to him. I heard about you that you are a very good officer. Yes, I am a very good officer. And I said, I heard one more thing about you, that you will not listen to anyone. You are stubborn. He looked me with pathetic mood, You heard it? Yes. Yes. I am somewhat like that, she said. Then I said, no problem. That is not my problem. I have some policies, I have political will, and you should help me to implement these policies, you know. Then no problem of your character or like that, you know. But he was a very good officer. Every time he sit with me and discuss about the issues, and sometimes he asks me, Minister, I have some suggestions and I have some project with me. Then I will not deny any project he put forward, you know. For example, one day he asked me, Madam, I have a project with e-health. We should have to implement e-health in health sector, and we got 92 crores of rupees from central government. Are you ready to implement it in Kerala? 92 crores is not a huge amount, you know. But I said 92 crores, you got it. Then how can we get rid of that money, or how can they deny that thing? And then he said, no, you cannot say like that. Your party's policy may be different. Yes, and you should discuss with your party. I ran to Chief Minister and said, there is 92 crores rupees from central government to implement e-health. CM, whether we can implement it. CM said, it is good. Without the e-health, we cannot move forward. We cannot make it a technologically fit health department. But you should write a letter to the party, and they should have a discussion on that. I am angry saying, sorry, Comrade. And in our party committee, they discussed it. Some of them said, no, we cannot, but the data should be released to even USA. It will go to the, if we implement e-health, that is dangerous.
Yeah.
Then I said we have some kind of protection of data. As we are making that kind of software, that kind of application to serve our data, and we should have to do this. Otherwise, we will go years before. We want to move to 2030, you know. And if you want to move to 2030 technology, we should have to implement this. Then most of us agreed, comrades agreed, teacher, you can implement that if you are enthusiastic. And I came back and called Rajasthan and said, yes, we succeeded, we can. But the problem is that the 92 crore is too little, you know. And the central government people came one day, and I cannot attend that meeting at that. I have another meeting at that time. I was sitting in my minister's office, and from there, some doctors called me, Madam, you should come urgently here. There is a conflict between the central government people and our doctors. They are quarreling each other. And I rushed that. And I asked what happened. And the central government officer said, with the 92 crores rupees, you should implement everything in every district, and we should get the utilization certificate. I asked them to cool down, and slowly I explained that this is not enough even 1,000 crore rupees is not enough to implement e-health throughout Kerala. We have such kind of hospitals in Kerala, you know. So we will implement it in one district, and you will get utilization certificate. And is there any problem with you to implement e-health with our money? And they said, no problem, you can implement it. And they were very happy at that time. They thought we are asking money from them again and again. So they agreed, and they went satisfactorily. And we give utilization certificate of one district. And with the help of local self-government and with some business field, we get their money, community money for CRS fund to implement e-health. Now we had implemented this thing in 800 of our hospitals, you know. We have some more hospitals, but we had implemented e-health in Kerala. That is why some conflicts between the bureaucrats and government policy is there. If we understand properly, or if we have a political will, we can make the bureaucrats with us. They will do for someone. Sometimes they will deny everything. They are not following. One more thing I say so shortly. When we started to convert the primary health center to family health center, there were only one doctor in a PHC in Kerala at that time, and the functioning was up to noon time. And we decided to give 2 more doctors and 5 staff. We decided to create 5 more staffs for the family health center. But the doctors came to me, doctors organization, KGFOA, the representatives came to me and said, we will not allow, we will not work. We should get 5 doctors in a PHC to implement this thing. I asked them, what is the problem? Now only 1 doctor is there and you are asking for more. We are giving 2 more doctors. One should sit afternoon, one afternoon, and one should do all the other field works, Enough. Then they asked me what happens if a doctor gets something wrong in his health in the afternoon session. Then I asked them what you should you did in these years, these years. Only 1 doctor is there. If he get ill, what is the matter? We can say to the people that he is not well when the doctor is not here. But they started strike. And I have already faced that thing, and I didn't ask them to have a discussion. And the day after day the strike was going on, but they become tired and they asked me, please call us for discussion. I said, I will not invite you, but my door is open. I am here in my minister's office and my door is open, you can come, you can discuss anything. And they came back and we discussed it together. That is at 7 p.m. They came to me and we discussed it, and they said we should have to withdraw the strike. It is not possible to continue, but you should be with us, madam. And one thing you should do for us, that is, if any doctor become ill, you should supply a doctor from district pool. You should have to make a district pool. It is already there in the project, But I said for the satisfaction, yes, I agree. If any doctor become ill, we will send a doctor from district pool. Oh, they agreed, and we together faced the this thing by to media. Media were there at 9 p.m. They were standing there to get from us. Second day, the media reported that the doctors' strike, they failed. The doctors failed in the strike. But I called them back, said, no one failed, no one gained. They are my doctor, what one doctor. We are implementing this family health system together. They are with us, with me. So no one failed here. I give a report like that. Then they become very happy, and they helped me very much to implement this family health system. The striking doctors become my friends, and they keep it up throughout the 5 years. That is the bureaucracy.
Can you share with us any 1 or 2 anecdotes from the time during COVID? Because those were very difficult times. You, your teams were working under tremendous pressure. You did not have access to all the right information, and yet you all were able to do some wonderful things. So some specific anecdotes that were turning points during that process for you and your team. I think it'd be great for everyone.
Yes. We followed the containment method. That was the most important thing. Throughout the world, there were only 2 methods, either containment or mitigation. In my assembly, the opposition leader asked me just after the reporting of COVID in Kerala, that is 2020 January, January 30th. And February we have assembly. That assembly, no one died in Kerala at that time, but in USA, COVID went just after 1 month, it is reported in Kerala. And at that same time, 2nd month of COVID in Kerala, 1st month of COVID in USA, 25 people died in USA at that time. And when I am explaining about the this control room and every setup in the assembly, the opposition leader said me, why are you bewildering all of the people? Why are you become such furious way, making some curiosity in people or fear in people? We should have to accept the mitigation method. It will go, the virus will go to the society, and when everyone get COVID infected, it will go back, There's a science in that, doctor. But we discussed it together, my health staff and me. And we decided that we cannot allow the virus to go to the society because Kerala is vulnerable in front of this kind of infectious disease in 3 ways. One, the population density in Kerala, it is 860 in 1 square kilometer, 860 people are living there. Our country's the percentage is 470 and double is in Kerala population density. Second thing is the old age population, that is about 20% in Kerala, old age population about 60 now. That is also a vulnerable thing in front of the infectious disease. And the third is the communicable, non-NCD, non-communicable diseases, lifestyle diseases. That is also rampant in Kerala because of the lifestyle. These 3 are our vulnerabilities. If we allow the virus to go to the society, above 60 will definitely succumb to death, comorbid people. So we thought the important method or the safe method is to contain the virus, not make it break, the breaking of this trend. And we started the quarantine, isolation, etc. Home quarantine was also there, and we started several. Our slogan is to put the virus under the health system capacity threshold. We never allow this virus to come up the health system capacity threshold. Means every day and every time we were improving our health system, increasing bed, increasing ICU bed, and increasing oxygen bed, everything. And we started domicile care centers in ground level with the help of Punjab's local self-government. COVID first line treatment centers in some community halls, etc. We converted like that. COVID second line treatment centers also, and our medical colleges, isolation units, etc. And we trained our people to find out who are coming out from abroad and to examine them properly and make them whether to put in quarantine. And we trained some medical people to examine the airport. And the first time some medical students came back from Wuhan, China, and our team got them. They revealed that they are coming from Wuhan, and at once they picked them up and quarantined in our hospital, for the incubation period. We should have to wait whether they are infected or not. We got 3 students infected by COVID within 14 days, and we isolated at once and treated them, and they cured and went out. But a family, that is the anecdote, the family came from Italy. They didn't reveal it. In airport, we cannot forcefully examine them. They should have to cooperate. And they didn't reveal where they are coming. They are coming by Jeddah or like that, not directly coming from China, Italy. And they went to their home, and after 3 or 4 days of their coming, an hospital in Pathanamthitta, the doctors find out some kind of symptoms like COVID. A patient came there and she have some symptoms. And they asked whether anyone come to your home or whether you go outside anywhere. And that lady said that yes, our relatives came from Italy to us. Whether they have any disease, no, they have cold and cough, nothing else. Cold and cough, nothing else, they said. Then we forcefully tested the people, they have some but they traveled within these 4 or 5 days. They traveled in Kottayam district, Kollam district, everywhere. They visited and gave COVID to everyone. We have to trace all the contacts, and that was a hazardous job. That time we applied the new method. A special app was made for contact tracing. And we traced all the contacts, first line contact and second line contact. We traced everything and isolated contact and quarantined all these people, 3,000 people we quarantined because of this Italy people. That was, I explained it in our book. And There was very bad comments about this family in Facebook at that time. They were cheating Kerala like that. At the time, I also have one Facebook post that nobody should blame that family. They didn't know what is the consequences. They have to go back to Italy to get a job for their son there, They came here to collect some certificates, that is why they are not the criminals or like that. I have a Facebook post of mine, that time it stopped. And when they go back, they called me personally and give thanks to me. That was a very heart-touching experience, That was almost that, such kind of.
So, since you talk about this, and we are here where there are many students of journalism, from your end and your experience in the world of TV with Reach and yours with COVID and with the experience you already had with the media and you also being part of the Hindu group, what would you have to say to these young people in terms of responsible journalism? Yes, primarily we're talking about public health, but responsible journalism per se, checked, data, hearsay, rechecked, because that in turn during times of difficulty does affect the common man and perception in society. I, like you,
very nervous to say this in front of Panir, who is the authority on journalism and ethical reporting. But it's just, I think it's just beyond just verifying facts. And this is all so basic to all of you that I dread saying this, but I would like to just repeat it when you're reporting on something. So you need to not only verify your fact, but you should have trusted sources. And we are not expecting, I always have this when we do our media training, that we expect you to take something forward. We're not expecting journalists to become activists. But you all have a social responsibility to be very, very careful. I'm not saying you should suppress news or just present it in the way that encourages discussion and debate. But there's so much of, especially we saw, madam, during COVID, the amount of misconceptions, misinformation. Every day people are out there in the media, scientists and doctors saying this is from the whole range of drugs, from ivermectin to President Trump's Clorox, everything found, so we need to pause, especially today in this world when news spreads like wildfire. I think responsible journalism means to really be aware of what impact your reporting may have on the community response. And basically, I think everyone has to be a responsible citizen, whichever profession you are, and far more if you're in the media. And especially when media is so fast now, it's available everywhere. So I think just be conscious of what you're reporting and trust your source and and think about the impact of what you're going to say. By no means am I saying you shouldn't report on to say that media must be muzzled, not at all. But you have a civic and a social responsibility about what you report. I think I'll stop lecturing.
They should have social responsibility, but the society is not like that. If they joined in some company, media company, how can they express their own ideology, their own opinion? It is too difficult nowadays. The corporates are they are buying this media themselves, and these journalists are forcing, they are forcing them to propagate their own idea, false news, exaggerations. During the pandemic time, every media throughout the world faced, not media, the health system faced one threat, that is infodemics, The information, false information, it is going down, and once during Nipah period, one man have a Facebook post and they propagated, someone shared it, that no one should eat chicken because Nipah is propagated through chicken. And we caught him and questioned him, police questioned him. Then he said, forgive me, I want to get rid of the high price of chicken. That is why I give such a news. That is a simple example, but the big media, main media sometimes give such a rubbish, such a what I used to say, nonsense things as big news, and they are propagating these false things in the world. That is the very dangerous thing. And I want to say that try your best to be true, be prudent, and try your best to be bold and give very true information about the things. You can study things. There are so many journalists in Kerala who studied well about Nipah and COVID, and they propagated, they correct things scientifically. Each and every evening, as a health minister, I have some briefing with the press, and I give an appeal to them that I will say anything and everything you ask. I will not hide anything from you, but you should give the proper news. Don't add your opinion with our findings, you know. That is the important thing. The department will say the things, and don't add your opinion in the news. You can have your opinion in another article or your own article, but in the news you cannot add. Secret was happiness. Okay. That is the happiness of all victory, you know. If you want to win, never become and we should show our enthusiasm in our face, you know. While I was minister, so everyone asked me the questions during the Nipah period. I have some worries, and I am also feared about this Nipah virus. It is a killer virus, you know. But when facing the media and facing the people, if I show my worries, people all will follow me on that. And so I returned. I was enthusiastic. We can get rid of this. Don't worry, I'm here. Our government is here. And that enthusiasm, the poor people liked a lot. After that, they told me every time when we saw your face, we become cheap from the That is the, then it became a habit of me that to facing people, don't show your worries and your mistakes or your any worries you cannot reveal to the people. Try to smile in front of them. Smiling means enthusiastically, not a full smile. That we cannot accept, you know, every time. In a critical period, you are smiling and you are laughing. Not like that. We should have to keep our position. We have to smile and we have to show the expression, the body language and our language, the way we put the things. That is very much important for a political worker and also a journalist.
Thank you so much to both of you for these inspiring talks and wonderful evening, and thank you all for being such a great audience. Thank you.
Thank you, sir.